I'm Dennis Anderson along with Julie Zenner, and here's what's coming up on Almanac North.
COVID-19 cases are on the rise again with the Delta variant. We'll talk with an infectious disease doctor on what you should know about the new strain.
The Duluth School District has a safe learning plan to return students to the classroom full-time this fall.
And a converted school bus turned museum exposes some dark chapters of our nation's history.
These stories and voices of the region next on Almanac North. Hello again and welcome to Almanac North. Thank you very much for watching. And Julie, summer is speeding by just a little too quickly.
It's going fast. I can hardly believe that August is already coming up this weekend.
It's knocking on the door, isn't it?
It is indeed, and
Okay.
Winter shortly thereafter.
That's exactly right. Go ahead.
All right. Right now it's fire season. Fires burning in Canada and northerly winds created some of the worst air quality in Minnesota history this week. The poor air quality can be especially unhealthy for folks with asthma, COPD, and other ailments. On Friday afternoon, the Pollution Control Agency extended the air quality alert through next Tuesday.
The Duluth Transit Authority named Rod Fournier its new general manager this week, removing the interim tag from his job title. Later in the week, the DTA announced it would temporarily suspend a handful of routes due to staffing and parts shortages. Fournier said the Transit Authority is hiring new bus operators and working with supply chain partners to resolve the parts delay as soon as possible.
Well, expect more closures and detours around the Twin Ports Interchange project beginning Monday. The ramps between southbound I-35 to northbound Highway 53 and I-535 from Superior to northbound 53 will be closed. Watch for the signs marking detours if you're traveling through that busy corridor.
And the Wisconsin Department of Natural Resources will launch Operation Deer Watch on Sunday, asking citizens around the state to report deer sightings. The DNR says registering deer sightings provides crucial data for deer management. Citizens can report deer they observe through a simple online form. You can find the link on the Wisconsin DNR website.
On Thursday, Minnesota Governor Tim Walz announced the state will join an initiative started by President Biden to slow COVID-19 cases. Any Minnesotan who gets their first COVID-19 shot beginning today through August 15th will receive a $100 reward. It's an effort to get infections under control with the Delta variant of COVID racing through the country. Well, here to tell us what we should know about the new variant is Dr. Rajesh Prabhu, infectious disease doctor with Essentia Health. And doctor, thank you so much for coming in and sharing some of your insights with us tonight. Are you seeing a lot more cases of COVID-19 starting to come through the hospital?
I don't think it's picked up tremendously as of yet. I think these rises in cases are in pockets of country that you see that people aren't, the lower vaccination rates are those people that haven't had COVID before. So this area has, a decent vaccination level.
Doctor, how does the Delta variant differ from the other variants?
Well, I think it's more contagious and it's more transmissible to other people. So meaning if you have a Delta variant COVID, your chances of it transmitting to other people are more than the previous versions of Delta. And that's why you're seeing cases rise throughout the country.
And are you seeing Delta show up in this area when people get their COVID-19 results back? Does it tell what kind of a variant it is in the positive?
I think you can say most of the country, the majority, well over probably 90% are all Delta. And that's the issue, is that every version of the variant that have come through the United States, one got the top dog and someone come to replace it. So Delta is the new coronavirus that's circulating.
The CDC is recommending that people go back to wearing masks, probably pretty much across the board, all age groups. What kind of response do you think the country is giving in return for that request?
I mean, I think it's a very reasonable request, and this is the reason. First, it's more contagious, and people that are even vaccinated can get COVID-19. But the good news is that the vaccine prevents serious versions of COVID, meaning so sick that you land in the hospital. So you may catch COVID, but your chances of having a very poor outcome are very minimal.
Doctor, are there any legitimate concerns in your mind in terms of why people are hesitating to get the vaccine?
You know, I haven't heard personally from patients regarding that. I think it's more understanding of how serious COVID-19 can be. So in the United States, and in this region, went through a period where we had a significant portion of our hospital full with just COVID patients. We even dedicated wards to COVID. And you know, I've met patients in the hospital that have gotten COVID and didn't realize how serious it could be. So now that we have a vaccine that's very effective, it could really prevent those chances of getting a severe case of COVID.
So should vaccinated people still be concerned about getting COVID?
Oh, certainly. I mean, especially with the Delta variant. I mean, it's been shown that you can still get COVID even if vaccinated, but the point being is the odds are you would not get a severe case, meaning it's 93 to 100% effective from preventing you from being hospitalized with COVID if you do catch it.
Is it frustrating to you, doctor, as a medical professional, to see how COVID-19 and vaccines have really kind of gotten wrapped up in politics in the country, and people are taking stands not necessarily based on science, but based on political views?
Yeah, don't quite understand why it's so politicized. I guess think of it when I talk to my own patients, you just sort of present the evidence of why we think a certain thing is beneficial, COVID vaccines. And usually they come to the similar conclusion what the medical professional is suggesting.
Doctor, what's the concern with children? At what age maybe should kids start getting the vaccine?
Well, I mean, it's currently approved from 12 years and up, so they're studying for younger age groups at this time. So at the moment, they're recommending anyone above 12 years of age to get the vaccine.
Is there any reason yet why maybe younger than that wouldn't get it, or we're not sure yet?
I think before they approve it for any age group, they do try to study that, right? So they are studying it in younger age groups, and once they have enough information on the safety, efficacy, then they would go ahead with probably an emergency use authorization.
Given that that authorization hasn't been provided at this point, any concerns for maybe folks who are pregnant, who have a baby that they're worried about?
Yeah, I mean, I think pregnancy, just like for influenza, COVID, you can have a more severe case. So certainly recommendations, wasn't approved for pregnancy, but it's certainly recommended to get it because it's just that risk benefit.
In the medical community, what's the general outlook about COVID? Are we starting to get the upper hand? Do we feel like we're getting there?
Well, we thought we had the upper hand just like a couple of weeks ago. So I think unless, majority of the population is vaccinated or has caught COVID, you have to get this level of what they call herd immunity, right? You've heard that term.
Yeah.
But herd immunity is local. You can have at a national level, a high level of vaccination, but if you have pockets in the community or who you associate with that either have not had COVID or have not had the vaccine, you're at risk for getting COVID.
Do you think once the non-emergency approval comes through, the hesitancy will go away and more people will line up to get the vaccine?
I think probably for a certain percentage, but I don't know exactly, who are thinking in that way.
There continues to be a lot of talk, doctor, about booster shots. Does it sound like, do you think we're going to be having to have some booster shots in the future?
Well, I think they continuously reassess that. Prior to Delta, the thought was a healthy individual would not need a booster because at this point in time, it seemed to provide very good protection. I know they're discussing for people that have health conditions, immunocompromising health conditions or particular age that they may recommend boosters. The CDC is currently, evaluating that.
One of the things that I hear from people who have had COVID is that they have a natural immunity. They don't need the vaccine. Are the vaccines more reliable or do they provide better protection than a natural immunity would give a person?
I mean, there's 2 points to that. In terms of, at this point, we do know that, natural immunity, they've studied at least 6 to 8 months in terms of protection. I think the point is for the vaccination, the thought is that it boosts your immunity level, so maybe it reduces your chances of getting a second episode of COVID.
Many of us get annual flu shots. Could that also happen where we get an annual COVID shot?
It's to be determined. I know they're thinking about booster shots for sure, and it depends when this all thing settles out, what is the predominant strain out there? Is it going to continuously evolve?
Do you think that now that COVID has gone global, can we ever reach a 0 point? Or is it just something where we're going to have to find an acceptable level of the virus and maybe even an acceptable level of deaths that we just have to live with?
I mean, I think at some point when it travels throughout the world, the population, you'll get to sort of this homeostasis balance where it still circulates, but it may not be as lethal, or lower percentage of people get infected each year.
All right. Well, Dr. Prabhu, thank you so much for coming in and sharing some information. I'm sure we'll have you back again.
Yeah, thank you for inviting me.
Thank you very much. And it's time now for this week's edition of Voices of the Region. Each week we hear from a journalist in the area on the stories they are covering. This week, author and columnist Aaron Brown from rural Itasca County is our guest.
On the Iron Range, you have to keep up with what the mines are doing. And, really it's a summer where the mines are running very heavily, generally high demand for the steel and iron ore products. So, that's the kind of undercurrent. But of course, we're still wondering about a few of these projects that are, proposed, hopeful projects for the local people who want to see them happen. And one of the ones that's been most vexing is this formerly called the SR steel mine, the now Mesabi Metallics project near Nashwauk, Minnesota. And we had a little bit of an update on that this past week. Mesabi Metallics, which is the current company of record on this site, basically made up of former SR people and their money backing this now independent venture trying to build a taconite and iron nugget plant there in northeastern Minnesota. Well, they've been having enormous financial problems, as we've covered for many months and years. And nevertheless, they now have a new CEO, a former U.S. Steel executive, Larry Sutherland, who is, I guess they're trying to come back on the stage and get their project back on track. And one of the things they did last week was announce that they would purchase a section of more than 3,000 acres of land adjacent to the project. And they made a big announcement about this. And the idea was that shows that they're, expanding. They're trying to get a hold of this property and get their project financed, which is really the question, is whether that project will be financed or not. Well, there's a counterpoint to that, and that came from Cliffs, Cleveland Cliffs, which is the company of record on the whole range. They're the largest steel maker in the United States now, and the largest producer of iron ore in Minnesota. And they have been trying to get a hold of this same property because they need iron ore for Hibbing taconite to remain viable. Hibbing taconite is running out of ore in its current location. And so they pointed out that while Mesabi Metallics purchased this land, 47% of it, or I think that was the number, is still had the mineral rights are still held by Cliffs. So there's still, even when you see something break loose and it looks like there might be a big update, it's muddy. These two companies are playing a game of chess. U.S. Steel is hanging around as well. They have property near there, and they also need iron ore for the future. So we're seeing this still play out. We have been in a maybe not a historically worst ever drought, but I want to say that some of what I've been reading here in northern Minnesota, we're in at least a 30-year drought. In other words, it's been at least 30 years since a drought of this magnitude, and we're not out of the season yet. Fall can get even drier sometimes, depending on how it goes. So we're in a very deep drought. And then, of course, if you've been following the news of the past, couple of weeks, the only moisture we seem to get comes in the form of storms. And so we had several bad storms over the last 10 to 12 days. Even though we did get some substantial rainfall out of the storm, it's not as much as you'd think. And we're so far behind on our rainfall that we're actually going to need several inches of water to really make up for what's been lost. And, people are wondering, how are we going to get our boats out of the lakes this fall? How are we going to bring in our docks? The water is so low that It's all mucky. It's hard to get equipment in there to pull things out. So we're going to see how it goes. Obviously, we'd like to see some more rain and some gentle, some friendly, happy summer rain in the near future. Anybody who drives I'm from Itasca County, and so you drive through the Wabana Road down central Itasca County, and you see this chipmunk that comes out every summer. It's a resort there, and it's a cute little chipmunk. I shouldn't say little; it's big, big wooden chipmunk that's been painted, and it's kind of a little, a little landmark, a little local color. It often has a 4th of July outfit, or it gets decorated in patriotic gear. It's only the most recent chipmunks that have kind of spoken to our broader world, which is COVID-19 last year, and this year the fire danger here in northern Minnesota.
The Duluth School District unveiled its Safe Learning Plan last week. The district intends to return all students grades K through 12 full-time to the classroom this fall. The return to school plans are subject to change and will adhere to state and CDC guidelines. Here to tell us about the plan is John Magas, Superintendent of Duluth Public Schools. Superintendent, thank you for being here. Appreciate you coming in. And as we mentioned, you released that Safe Learning Plan last week. Did this week's CDC warnings change anything for you?
Well, the plans that we put forward are in compliance with what was recommended. As we said in the plan the week before, was that we needed to be ready for potential change, that we needed to be nimble, and we continue to want to make sure that we're flexible. We know that there's several weeks before school starts, and so we want to make sure that we're watching the situation evolve and also look at how the state and regional health departments are recommending to us and other districts as far as what we do moving forward.
So what are the highlights then of the Safe Learning Plan, John?
Sure. So basically we are requiring masks for our elementary students as well as the staff that are working with our elementary students, because that is the majority of our students who are under 12. And some might ask, well, why would you want the staff to wear the masks if they're vaccinated? And the rationale behind that is that they can still be carriers and spread it to the children, and also we want to make sure that there's good modeling there. We will consider, though, with the new state guidance, there's a strong recommendation for masks for secondary, so we do have to consider how does that play out with our needs in the community.
What about vaccinations? As you look at the district, are you requiring vaccinations of students or asking that they tell you whether they're vaccinated or not?
Not at this point. We're watching how that's evolving. Most districts are not requiring that at this point, but we are strongly encouraging, and we are partnering with our local medical providers to make sure that we have additional vaccine opportunities for the students, vaccine camps and such, so that will be an opportunity for students to get vaccinated. And also, if the vaccine is released to younger students, we want to be prepared to have them vaccinated as soon as possible. Also, the governor released a new plan this week, Vax to School, encouraging people to get vaccines now so that they can be fully vaccinated when school starts. So if there are students who are over 12 or older, it's important that they get those vaccines in if they haven't had them yet.
Superintendent, is there a plan B if your current plan does not maybe live up to what you expect it to do so?
Sure. So we always have a plan B and a plan C, and we make sure that we're flexible. I think this year has really taught us. There used to be a saying that it took 5 to 7 years to have true change in education. I think this year put that theory on its head, because I think we've been able to be very flexible in a matter of days or weeks, depending on what occurs.
Does part of that flexibility include if a parent isn't really convinced that it's safe for their child to go to school, can they still learn at home?
We are having full in-person instruction. We do have online instruction for our high school students through the AEO Learning Center. So that is still an option for our older students. But at this point, we are offering full in-person for our students.
And why is it so important to get students back in the classroom full-time, in your opinion?
Sure. Well, I mean, I think for most students, research says that students learn better when they have that face-to-face opportunity. Mm-hmm. And I think that it helps us with engagement, making sure that our students are engaged, our staff is engaged working with the students. And also, I think those social, emotional, mental health connections, mm-hmm. that's really important for our students too. Even the connections in having friends and seeing other peers, I think that is really part of the school experience.
Mm-hmm. Has there been any assessment of how well distance learning served students last year in terms of anything that you can measure, significant changes in performance or outcomes?
Sure. I mean, I think nationally there have been studies that have shown that there has been some gaps in learning, and also that those opportunity gaps or historically underserved populations, that some of the gaps with those students have widened even further. So I think it's really imperative that our schools focus on making sure that our instruction is high quality as possible, and that we're really thinking about how do we take care of the whole student, but then thinking about remediation, and also how do we improve the learning for students so that their trajectory over the course of the next few years is an opportunity where they can be even further ahead than they might have been otherwise.
Some parents might be wondering, how often will the Duluth school buildings get a thorough cleaning?
Yes. So actually we're following the same cleaning guidelines we did for during the pandemic last year. So we are having daily cleanings, and we also have very high quality air filtration systems. So those are really important to us. So all the same standards that we had last year, we have in place for this year.
Mm-hmm. So part of the upgrade of schools a few years back, where new schools were built and schools were revamped, included some air filtration measures.
Yes. And so we're actually above the state standards for what we need for our air filtration. But we're always looking for ways to improve, and we always will continue that as well, whether it's for learning or whether it's for safety.
What kind of extracurricular activities will or will not be permitted?
Sure. At this point, we are planning for a full return of our extracurricular activities.
All sports?
Yes. We are waiting for the high school league to share their announcements as far as their guidance for athletics. You know, we have to look at what would it look like for spectators, what would it look like for number of people who can be in the building, and also what does it look like there. We also found that a lot of times when we have teams traveling, we want to make sure that they're complying and wearing masks and taking care of those safety needs, because sometimes that can be a place of spread too.
Mm-hmm. I imagine a lot of parents are watching what's happening with the variant and watching what's happening with new masking mandates. Where do they get communication? How it's got to be really important for you to be having a free flow of communication right now with families and with your staff.
Sure. So both through our social media and through our website, those are two main conduits of information. We also come out with regular updates for the school and the community for our parents, our newsletters. Those are a couple of different ways that we share the information. Also through our board meeting updates and the plans that we have on the website. But we do have links to all of our planning right on the website.
All right. Superintendent John Magas, thank you so much for coming in. Good luck as you head toward the school year.
Great pleasure, and thanks.
Thank you very much for being here.
Thank you. Take care.
Well, it's not often you see a museum on wheels, but this week, a Bus-seum, a retrofitted school bus, was parked next to the Clayton Jackson McGee Memorial in Duluth. The Trellian exhibit features a reflection on racism's origins and explores the context of lynchings and related social issues of the 1920s. Videographer Steve Ash visited the bus on Tuesday and put together this story.
We invite people in, they look at the panels, they watch a video they wouldn't otherwise have seen.
Are you ready for films?
And then we go to the next town, and we've been to northern Minnesota logging camps, inner city Chicago ghettos, we've been to western Nebraska cow towns, so we take history to where the people are. We go all over the Midwest, and we take stories that otherwise wouldn't be known. That's why this exhibit, I think it's our 8th, is called Hidden or Forbidden No More. These are stories that people don't know about, and if they did, they don't want to talk about them. For example, most poignant here in Duluth, and that's why we're here, we talk about the tens of thousands of Klan members who were in the Midwest in the 20s. I only found out late in life that my great-grandfather was in the Iowa Klan, there were tens of thousands everywhere. They were in Duluth, they're everywhere. And so this tragic, ghastly lynching story is part of a larger story of the social and political instability of the 20s. Right after World War I, after all that German hate, the anti-German hysteria of the war, you had Prohibition, which was new. People were getting anxious and upset. You had the flu pandemic that just happened. So people were in a tizzy. And one of the things that we tell here in this exhibit, really it's by implication, this is a moral tale. When a society becomes so divided and so politically unstable, horrible things can happen. Our 5 subtopics all have concurrent parallels in the modern day. The pandemic, 1918, racial relations in the 20s, but also the cow war. I mean, we talk about social unrest in the Great Depression. So each one of our stories, the anti-German hysteria, there were serious proposals to put a wall around Wisconsin and wall in all those disloyal Germans. Well, we're still talking about walling people in or out. So that's what we're working on, is we bring these hidden and forbidden stories and we say, no more. We need to know this stuff. Are we learning from that? What's my obligation? And when I find out that my great-grandfather was part of this franchise, hate, institutionalized hate, I'm not guilty, but I have an obligation to make a better world. I can't change everybody and everything, but I can do this.
Well, before we go, we'd like to wish the best to longtime WDSC employee Julie Denoyer, who retired this week after a 40-year career here at the station. If you're a supporter of WDSC or ever called the station wondering about a thank you gift, chances are you talked with Julie in the membership department. Julie put together hundreds of thousands of mailings over the years, and it's said that she knows the zip code of every small town in the region. And she did it all with a smile on her face and an incredible work ethic. Julie, we'll miss you.
And we're out of time, but you can keep up with our latest posts by following Almanac North on Facebook and Twitter. Visit the WDSC website for program updates, upcoming events, and more information about the station. And download the PBS video app for on-demand viewing of your favorite PBS programs and past episodes of Almanac North. And Julie, we want to wish all the best to Maya Corbin, who has been a stellar member of our floor crew the past few years. Maya graduated from UMD this year. She's moving on to a full-time job in the Twin Cities. Maya, we will miss you. She's right behind that camera right now.
As she has been faithfully
For
the last 3 years.
Yeah,
Thanks,
really
Maya, and best
it.
of luck as you head into your new job.
Absolutely.
We love you here.
And thanks to you, Maya, and to all the floor crew and to all our guests and the crew in the studio. With Julie Zenner, I'm Dennis Anderson. Have a great weekend, everybody, and be kind.